Hello everyone, want to welcome you back to my channel again. Want to dive into a topic today that's a little different from some of the ones I've been talking about so far, and that is an intriguing topic, and it's something that's on many of our minds these days, and that is healthcare, kind of specifically the evolution of healthcare and what we call health sharing, okay? So we're going to get a little bit into all of that. And you know, health sharing started, quite a long time ago. Actually, you could probably go back into the biblical times that it really started. But probably in the 80s is when it really kind of caught on in the United States. And that is where people, a lot of times it started with religious groups where people were working as a community to help cover other people's costs of insurance. And so everybody contributed. It wasn't always a perfect world in how it worked in the beginning, but it became more and more refined where people were putting in a certain amount of money every month. Everybody was expected to pay a certain amount of their own expenses first, and then those that needed the help were taken care of with the sharing of everybody. And you know, there's definitely some advantages to it. There's a little bit of a downside as well. There can be, depending on your health and previous issues. But you know, people today are looking for alternatives, and it really wasn't a trusted alternative in the beginning because, you know, it's like, you know, who knows? It might be sketchy, right? And so people were really kind of worried about it. But when the Affordable Health Care Act came into place, and it actually legitimized the what we will call the HCSOs, healthcare sharing organizations, by saying that they were exempt from the original individual mandate penalty that all of the rest of us had in the beginning. You don't have that anymore, but you know, you had that in the beginning. And they recognized these agencies, these services, as legitimate. And so people started thinking, well, it is an alternative, it is a viable alternative. And that kind of escalated things in the industry to people finding more options. And I've looked at a lot of different options online, but the one that I really like the most that I've seen is a company called Impact Healthcare. And there's quite a few reasons, but it just seems, number one, simple. And when I say that, I say everything is spelled out very simply, so even I can understand what's going on over there, okay? And I did have to look at it a couple times and ask some questions, but they're very accessible as well. So if you're looking to find one that is going to make sense for you, or even whether or not it's something you want to make it an option of, it's definitely a company to take a look at. Now, they are part of a network marketing company called ACN, but they're kind of their own entity, and a lot of people are flocking to being able to share that. A good friend of mine, who I'll give you a link of in my description below, to her uniquehealthbenefits.com. Sue is great at helping people. She will answer any questions you have, explain. If she can't get it, she'll get you somebody that can. And so in that vein, what I say is, look, don't just trust me for what I'm telling you, although I really think it's great, and especially for seniors, but really for anybody. And I'll tell you why, especially for seniors, as we go along. So if you look at Impact, they have a huge platform. Their members share their medical expenses, and they do it with total transparency. They're very efficient, they're cost efficient in many ways. It combines kind of the best of traditional health care with some unique approaches to manage and reduce medical costs, okay? So they're number one, they're super affordable. I think the lowest plan for an individual starts at like $73. Don't quote me on that because things can change, but I think that's about where it starts. And many families that might be paying $1,000 or plus will be able to pay as much as half of that with the impact health sharing. They're very transparent. You're going to see everything in your dashboard. You have an app. You can be able to watch it, check everything right there. The nice thing is you choose any healthcare provider. So you're not in a network. You're going to go to any healthcare provider, and they're going to give you, go into their portal that they'll send right to Impact, and everything is just taken care of pretty simply. You have to keep a little bit of an eye on stuff, just make sure things are going through a little bit more than you would with your medical health insurance, but that's great. They have a community, so you can actually get online with community, people that are all part of Impact. You know when someone is not doing well, and you can reach out to them and share your thoughts and your concerns. And you know what? In health, that's a pretty powerful thing. I mean, we do that with friends and family, right? But if you had a whole community doing that, praying for you or thinking about you, it's just pretty awesome, okay? They do have apps and portals, like I said, so it makes it very easy for it. And the few things that I really like is, number one, if you're healthy, especially if you're healthy, it's almost a no-brainer, because there are some exceptions for what they will accept. If you have a pre-existing condition, and pretty much any pre-existing condition, that pre-existing condition will not be covered for your medication or anything when you get the impact, okay? But if you're healthy, and that doesn't mean that you can't have others, you can still be covered, it's just that's not going to be covered, okay? So you kind of rule that out. And that's not so bad either, you know, so there are a lot of things that, you know, you want to do that. There's also some stuff that that they're not going to cover, and it's kind of based on their values. So you need to check out every company if you're thinking about doing this. Each company, like I said, a lot of this started with religious organizations, so you're going to probably see more conservative values in there in some of the things, and they may or may not cover them. But, you know, you make that decision for yourself, okay? But if you're healthy, man, go for it. I really think find a way to get it, get on it. It's going to be super affordable. And best case scenario is you say, okay, what would it cost me to have health insurance if I was paying for my own health insurance, or I am paying for my own health insurance right now. So I'm going to put the cost of what it cost me for the impact here, and then I'm going to have a separate account that I'm going to be able to put all the money that I would have normally paid for health insurance, and in no time at all you'll be able to see the savings, especially if you are healthy and continue to stay healthy. Now there are some downsides. They don't have the same regulations as insurance companies. I don't know, sometimes I think that's maybe not such a downside, that can really be an upside. Like I said, there's some exclusions, including pre-existing conditions, restrictions on certain types of treatments. You may have potential higher out-of-pocket costs, and you may have a lot less out-of-pocket costs too. So, but that is possible that you could have more up front, depending on what you're paying right now. And as I said, you know, look at different ones. The research I've done makes me feel real confident. Impact is a great choice, and you might find something else, but you'll be able to look on the link that I put into the chat. You'll be able to go to that site. Man, it covers everything. You can go on YouTube like you are right now, and you can find some videos as well. But if you got questions, you'll be able to call Impact Health. You may even be able to get your employer to offer it as something just by mentioning it to them. And ask Sue about that. She'll be glad to help you. You can email her or call her. I'm not sure. I think she has both numbers available there. So you can for sure at least email her, and she's very responsive. Okay. So that's the best I got on this. I thought it's a great topic to cover. I know a lot of people have thought about it. I've thought about it a lot in the past. Oh, and I did want to mention about seniors. The seniors have, if you are a senior on Medicare, okay, I believe it's $99. Yeah, it's $99 a month for the product. Obviously, Part A and B Medicare is going to take care of 80% of your expenses. This is going to take, and it doesn't matter if you have pre-existing conditions with the Medicare program. So take a look at it, get your questions answered, see if it's for you. Again, thanks for watching the channel. If you like what you see and you want to see more great content, put something in there if you want. I mean, there's a lot of everyday stuff that we deal with is stuff that I like to research and be able to help people have better options and better care with, okay? So make some comments on there. Let me know what you'd like to see me make some videos on. And of course, like and subscribe, click the bell for notifications. I really appreciate you watching today, and you have a phenomenal rest of your day.